The first day of school today. New York City kids going back to the class amid so much uncertainty with COVID-19. Thank you so much for staying with us. I'm Vanessa Freeman.
And I'm Tamsin Fidel. Well, let's talk about it. From the mass debates we've seen, protests, vaccine fears, remote learning versus in person. It's really tough just trying to be a kid these days. And all of it comes, of course, on top of last year, which is also disrupted due to the pandemic.
Absolutely. It's left many parents juggling their own mental health as well as that of their kids. Joining us now to dive a little deeper on this topic is Dr. Ruth Gerson of the New York Foundling Child Welfare Agency. Dr. Gerson, thank you so much for your time.
Thank you for having me.
Well, doctor, you have two little ones yourself, so I know you have had a busy 2 weeks, but let's go ahead and talk about it because you deal with mental health services for kids. What do you think right now really is the biggest hurdle New York City students are facing?
I think so much of it comes down to unpredictability. It's been such a tough, challenging year for children and families. And with so many children still too young to be vaccinated and the news about Delta contributing to rising hospitalizations in youth, families worry about lost learning time for the past year, but still so much that we don't know about what's going to happen. I think it's just a really unpredictable time for families, and that unpredictability is awful. The way we manage anxiety and transition is by planning and by weighing information and gathering information and talking to people about how we manage it. And when we can't do that, it's very destabilizing.
Yeah, it's really a tough spot to be in, but you do have some tips for the parents out there. The first one being prioritizing connection. What does that mean?
Yeah, what I mean by that is that it's so easy to get lost in the logistics, in planning, in trying to catch up on homework, and trying to catch up on the latest news about how much of a risk is, doing this activity or doing that activity. But it's really important that we maintain that time for connection with our kids. Prioritizing time to connect one-on-one with them, to really just make open space to talk about how they are, and also encouraging our older kids to make in real life, not just online connections with their peers and with their teachers. We know that kids who feel connected at home and connected to peers and staff at school are at much less risk for mental health problems and suicide, so making sure that we make time for that.
Yeah, it's so important. Let me ask you this. You say you have a validate, then evaluate concerns. What exactly does that mean for parents?
Yeah, I think as a parent, I'll say for my own self and in my experience in working with parents, we want to solve our kids' problems, right? So when my kids come to me and they say, Mommy, I'm scared about X. If my kid says, I don't want to go to my friend's house because there's a dog, I want to try to solve that problem, right? But what kids don't need is just for us to solve their problems. That it's a fix in a moment, but it's not actually a long-term solution for them. What they need from us is to validate their concerns, to help them feel not alone with it, to help them feel like, we're not minimizing their concerns. We're not saying that there's nothing real about it. We're not necessarily agreeing with the concern, but we're saying, I hear that this feels scary. I hear this doesn't feel good to you. This doesn't feel right to you. And then helping them learn to evaluate the concern. So for example, if a kid is scared about going back to school because they're scared about COVID risk, what information can we find together about, what's the community spread in our neighborhood? What's the school doing to reduce risk? What can we ourselves do to reduce risk? And then see how that feels. And also practicing how we can, feel more control, how we can gain that information, and how we can evaluate that information. We want our kids to be consumers of information, not just take what they hear from the media or from peers or whatever it is that might not necessarily be true. We want to teach them how to evaluate that.
Absolutely. There's a lot to weigh, but like you said, the most important thing is really establishing a consistent line of communication. Dr. Ruth Gerson with the New York Foundling, thank you so much for being with us.
Thank you so much for having me.